Hello, my name is Belinda. I'm a registered nurse and I'm going to teach you today about hypoglycemia. Do you know what hypoglycemia is?
Yes, it's when your sugar drops low.
Okay, yes. So according to the American Diabetes Association, a blood glucose level below 70 is classified as hypoglycemia. A good thing to know is anything below 54 is an emergency and you should dial 911. Okay. Have you ever experienced hypoglycemia?
I have. My hands start shaking. I get very lightheaded.
Okay, so those are some of the most common symptoms of hypoglycemia. Shakiness, cool, clammy, sweaty, anxiety, fast heart rate, might get pale, nauseous, headache. And those are occurring because when the sugar drops, it triggers the fight or flight response. And that's like adrenaline or epinephrine is released into your system. It's the same mechanism as if you were walking down the street and saw like a huge dog off the leash. It's that sudden rush of adrenaline, but it's happening, while you're going about your daily life, in your home. It's not situational, so it can be very frightening. If your sugar drops further than those mild symptoms, it can cause confusion, sleepiness, weakness, dizziness, and blurred vision. And that's because when your sugar drops so low, your brain is not getting enough glucose to function properly. And that's where you can lead into like a hypoglycemic diabetic coma or, God forbid, death. So another thing I wanted to talk to you about today is hypoglycemic unawareness. Your population of patients, elderly and diabetes, usually don't have symptoms of hypoglycemia. Sometimes they don't know that their sugar is low at all. So I wanted to teach you today about the proper techniques for glucose testing and when you should do it and what you should do if that occurs. So the only way to know if your sugar is low is to check your sugar levels with the glucometer. Do you use your glucometer at home?
Yes, I do.
Okay, about how many times a day do you use the glucometer?
About twice, 2-3 times a day.
Okay, good.
Depends on how I feel, actually.
Right. Okay, so are you taking any insulin?
Not insulin. I take, I'm type 2, so I take glipizide and I'm on Victoza.
Okay. So so patients that are on insulin, they usually take their blood sugars before each meal and at bedtime. In your case, you're on the oral diabetic medication, so you can take it daily, or if you need to take it, more than once a day or twice a day. If you feel those symptoms coming on, you can check your sugar. Best time to do it is before breakfast, so you have a baseline of how you're starting your day. Also, before or after any rigorous exercise, you should test your sugar because exercise naturally releases insulin. So if you're low before you exercise and then insulin is released, you can go hypoglycemic because of that. So you might want to snack before exercise. You can avoid hypoglycemia by checking your levels regularly, not skipping meals, and also make sure that you're on a consistent carbohydrate diet. What that means is it's best to keep your blood sugars steady versus having the ups and downs, because those are the things that make diabetes complicated. So I wanted to do a little bit of finger stick technique today, teaching. So just really quickly, I'll run through the steps and then we're going to do a demonstration. So the first thing you want to always do is hand hygiene. So washing your hands for at least 20 seconds with soap and water. And then also, if you're going to use an alcohol wipe, making sure that the alcohol is dry so that it's not interfering with the blood glucose levels. All right. You want to use a brand new lancet each time for infection control reasons. And you want to prick the sides of your fingers. You want to prick the sides of your fingers and avoid the pads because there's less nerve endings on each side. And you want to avoid the thumb and the pinky. The thumb has its own pulse and the pinky is not enough tissue to avoid an injury. Also, always try to alternate your fingers so that you're not ending up with a bruised finger. Then once you stick your finger, you apply the blood to the strip. And in your case, I know that you're on anticoagulants, on Plavix, so I would suggest to hold pressure to the site, to the puncture site, just to avoid any excess bleeding. Okay, so I'm sure you check your sugar regularly. I just gave you some tips on the way to do it. So now we'll go ahead and see how you test your sugar. Okay, so first thing is to always have a barrier, like a sterile barrier, right? So you're going to have your glucometer Lancet. We're gonna demonstrate. So you're gonna go ahead and perform hand hygiene. So you're gonna go ahead and wash your hands. And while you're washing your hands for at least 20 seconds with soap and water, I am going to set this up. So you're gonna have a gauze, or you can even use like a tissue. If you're gonna use alcohol pads, because you want to dry the alcohol off your fingers. So we did hand hygiene because that's the best way for infection control. But in this case, we're going to go ahead and act like you were just using the alcohol prep pad, just to kind of see what I'm speaking about, okay? So you can go ahead and...
you want me to do it?
Yeah.
To perform?
Yes.
Okay.
So you go ahead
so
and...
I take the...
Every glucometer is different.
Stick it in.
That's how it
get it
on.
ready. And
okay, so you're preparing your lancet, right? You pulled it off. Okay, so you would open the gauze.
I just washed my hands.
Yes, we're just gonna demonstrate how you would do it
okay.
with alcohol in case you're outside, maybe testing.
Okay.
Okay, so you're gonna choose which finger you're gonna clean. Very good with the alcohol. Then I would use a gauze or a tissue to dry the excess alcohol off. Very good. Then you're gonna take the lancet. You're gonna go for the pad, not the pad, but the sides, and you're gonna just. This lancet is automatic, so you're gonna press it down. Just press down. There it is, and you're going to squeeze. Very good, and that is the best way. Now also, because you saw how much blood came out, you're on an anticoagulant, I would grab the gauze and I would just apply pressure to the puncture site. Okay? So your blood sugar is 144. That's a decent reading. Usually, you're not anywhere near hypoglycemia. So this is a good reading for you in terms of the hypoglycemia education. Okay, so then you want to always, dispose of your lancets properly, dispose of your finger sticks properly, your lancets, and kind of put it away. So that's a very good technique. Okay, and then what I want to know is, in the event that you have a hypoglycemia, what do you usually do? What do you do when what's the lowest that your blood sugar has been?
68.
68. And did you can you tell me what happened that day? Like, what you felt, you took the reading,
I
what you
started
did?
shaking, and I started getting very lightheaded. So I reached in the refrigerator and got just a juice, and I drank that. Or if that's not available, I'll take a peppermint, and I'll have a peppermint.
Okay. So what I want to teach you today is what to do if your blood sugar is low. If we would have taken that and it would have been very low. So there's a thing that is called, it's from also the American Diabetic Association. It's called the 15-15 rule. So this is a handout for you to keep, and it's basically you're going to eat 15 grams of carbohydrates, and then you're going to retest in 15 minutes. And then that's kind of how you get your blood levels to raise back up without just eating a whole bunch of stuff and then ending up on a hyperglycemia. So examples of the 15 grams of carbohydrates are half a cup of fruit juice, a cup of milk, 6 to 10 hard candies, 4 cubes or teaspoons of sugar, 6 saltines, 3 graham crackers, or a tablespoon of honey. So if your sugar was low, you would grab any one of these or anything that equates to 15 grams of carbohydrates. But these are kind of quick go-tos. And then you would consume it and wait 15 minutes and retest. If you're retesting, your sugar is still below 70, then you're going to do it again. Eat 15 grams of carbs, wait 15 minutes, retest. Once your blood sugar level is 70 or above, you're then going to want to eat a meal or a snack to sustain your blood sugar level. Okay, so this is for you. It's made for you. You can go ahead and keep it. And these are examples of foods that you can eat or drink right when you feel a hypoglycemic event coming on, or when you end up just feeling the signs and symptoms, or if you test your sugar and you don't feel any symptoms at all, but it's very low, then you should do this. Okay, so do you have any questions on the go?
Yeah. What do I do if I'm on the go?
Meaning if this happens to you.
If this happens to me and I'm outside, or
That's a very good question. So first thing I would say is if you have frequent episodes of hypoglycemia, what I would suggest is definitely wear a medical alert bracelet, because then if you're anywhere and, you know, let's say you pass out or you faint or something, you have the diabetic medical alert bracelet that will alert anybody or any first responders that it could be a hypoglycemic event. Okay?
10 minutes.
Also, you want to keep snacks with you, maybe like a Ziploc of the graham crackers. These are very good. This is the exact serving of fruit juice. It's a 4-ounce fruit juice, so half a cup. And you can keep this with you. And in the event that it's not, you don't have this with you, there are these really good glucose tablets that are available at the pharmacy, and they provide 4 grams of sugar. It's not the full 15, but it's something that can help to boost you. Let's say you just have a juice or crackers and one of these. It can help to raise your blood glucose levels where you're not in that danger zone. So I would suggest to keep these maybe in your purse, this maybe with you, but definitely these are very good for emergencies. Okay?
All right.
Did you have any other questions?
I know, but thank you very
Okay.
much.
Thank you.
I've been very enlightened.
Okay.